The diagnosis of myofascial trigger points is done by palpation. First, we identify the origin and attachment of a muscle in order to determine the course of the fibers. Using the example of the infraspinatus muscle, I palpate the spine of the scapula, the acromion, the scapular spine to the medial border, then the medial border in the caudal direction to the inferior angle, and laterally upwards to the lateral border. This triangle is the region of origin for the infraspinatus, and the fibers move toward the greater tubercle of the humerus. The fibers that lie just caudal to the spine of the scapula that run transversally, and the fibers that lie in the area of the lateral border run diagonally. Depending on how the fiber direction is, here transversal, or here lateral diagonal, the direction of palpation is different, because in order to find the taut bands, first I palpate perpendicular to the fiber direction. I do this for the purpose of a palpatory overview examination, first in different sites in the whole muscle, and explore, are there somewhere distinctly sensible taut bands? I always palpate perpendicular to the fiber orientation of the muscle. Here I feel in the lateral area clearly a tensed muscle fiber portion, a taut band. And secondly, I am going along the muscle fiber. I keep going perpendicular to the taut band, going medially or laterally. And thus I identify this taut band and notice, is it everywhere equally tensed or differently tensed, and is it everywhere equally sensitive to pressure? There may be swellings or knots in the taut band, and I let me lead by the tissue. That's one thing. The second thing is that I'm mindful of the patient's reactions, often non-verbal reactions, for example, a jerk of the patient, signs indicating that this point probably is more sensitive to pressure. And then I ask, is it painful equally everywhere in the course of the taut band? How is that for you? How is it here? And on this side? There is more, isn't it? And here? And so I explore the spot where it's more sensitive to pressure. And if there are problems, I would now start to provocate this site and see if it's possible to reproduce the symptom known to the patient by pressure provocation or not. And thus I identify active trigger points.